Hi, today I will discuss external features of heart. The heart is a muscular conical organ situated in middle mediastinum, enclosed in pericardium. The external features include apex, base, surface, border, and grooves, also sulci. Apex of heart. Apex of heart formed by the mainly left ventricles directed downwards, forward, to the left. Lies in fifth intercostal space, 9 centimeter from midlines. Correspond to apex width. There is apex width. Base of heart. Posterior surface of heart is base of heart found by mainly left atrium, partially by right atrium. Base directed towards backwards. Receives. Base receive four pulmonary veins, superior vena cava and inferior vena cava. Now I will discuss the surface of heart. The surface of heart, there is four surface of heart. First is sternocostal surface, also known as anterior surface of heart. Diaphragmatic surface. Diaphragmatic surface is also known as inferior surface of heart. And left and right pulmonary surface of heart. Sternocostal surface, this is anterior surface, found mainly by the right ventricles, also by the right atrium and left ventricles. Related to sternum and costal cartilage. Diaphragmatic surface. Inferiorly, this is inferiorly, found mainly by the left ventricles, partially by right ventricles. Rest on central tendon of diaphragm. Diaphragmatic surface of the heart is rest on central tendon of diaphragm. Now, right pulmonary surface, it is found by the right atrium, related to the right lungs and pleura. Left pulmonary surface, found mainly by the left ventricles, slightly contribution from left atrium, related to left lungs and pleura. Border of heart. There is four border of the heart. First is right border, then second is left border, then third is inferior border, and fourth is superior border. Right border of heart found by right atrium extend between superior vena cava above and inferior vena cava below. This is the right border. You know the right border, upper right and lower right. Left border found mainly by the left ventricle, slightly by the left auricles, rounded and oblique. Inferior border found by mainly the right ventricles. Inferior border mainly found by the right ventricles, small contributions of left ventricles. Superior border found by the both atria, gives attachment to the ascending aorta, pulmonary trunk, superior vena cava. Groups, sulci of heart. There is three sulci or groups of heart. The first is coronary sulcus, that is enteroventricular groups. Anterior interventricular sulcus, and third is posterior interventricular sulcus. Now discuss the first, coronary sulcus. Separate atrium from ventricles. Coronary sulcus that separate atria from ventricles. Coronary sulcus contains right coronary artery, left coronary artery, and coronary sinus, that is posteriorly. Anterior interventricular sulcus that separate the right and left ventricles. That contains left anterior descending artery, great cardiac vein, posterior interventricular sulcus that separate the ventricles posteriorly, contains the posterior interventricular artery and middle cardiac vein. Now I will discuss the auricles of heart. Auricles, known as ear-like muscular projections, increase atrial capacity. Right and left auricles present. There is two auricles present. They are right and left auricles present. The clinical anatomy of external features of heart. Left anterior descending artery. This is also known as widowmaker artery because acute occlusion of these vessels often cause massive myocardial infarctions that lead with high mortality. Coronary sulcus, also landmark of for AV junction, apex B displacement in cardiomegaly, normal in left fifth intercostal space. Posterior surface closely related to the esophagus. Summary: apex left ventricles, base is found by the right atrium, anterior surface is right ventricles, and coronary sulcus, that is interventricular separation. Thank you. Please like, subscribe, and share this video.